NCLEX RN Exam Questions 2026 to test your readiness effectively. Question 1. The most definitive sign of pregnancy is: Option A, elevated human chorionic gonadotropin. Option B, the presence of fetal heart tones. Option C, uterine enlargement. Option D, breast enlargement and tenderness. The correct answer is option B, the presence of fetal heart tones. Fetal heart tones, fetal movement felt by a provider, and ultrasound visualization are positive or definitive signs of pregnancy. Question 2. The nurse is caring for a neonate whose mother is diabetic. The nurse will expect the neonate to be: Option A, hypoglycemic, small for gestational age. Option B, hyperglycemic, large for gestational age. Option C, hypoglycemic, large for gestational age. Option D, hyperglycemic, small for gestational age. The correct answer is option C, hypoglycemic, large for gestational age. Maternal hyperglycemia leads to fetal hyperinsulinism. After birth, the insulin remains high but the glucose supply is cut, causing hypoglycemia in a large for gestational age (LGA) baby. Question 3. Which instruction should be included in the nurse's teaching regarding oral contraceptives? Option A, weight gain should be reported to the physician. Option B, an alternate method of birth control is needed when taking antibiotics. Option C, take 2 pills per day for 1 week if a dose is missed. Option D, changes in menstrual flow should be reported to the physician. The correct answer is option B, an alternate method of birth control is needed when taking antibiotics. Certain antibiotics can decrease the effectiveness of oral contraceptives by altering gut flora, so backup barrier methods are required. Question 4. Breastfeeding is contraindicated in the postpartum client with: Option A, diabetes. Option B, positive HIV. Option C, hypertension. Option D, thyroid disease. The correct answer is option B, positive HIV. In developed countries, HIV is a contraindication to breastfeeding because the virus can be transmitted to the infant through breast milk. Question 5. A client is admitted with vaginal bleeding and very little discomfort. The nurse's first action should be to: Option A, assess the fetal heart tones. Option B, a check for cervical dilation. Option C, check for firmness of the uterus. Option D, obtain a detailed history. The correct answer is option A, assess the fetal heart tones. Painless vaginal bleeding suggests placenta previa. The priority is to assess fetal well-being, FHR, before any other interventions. Question 6. The nurse should tell the client that labor has probably begun when: Option A, her contractions are 2 minutes apart. Option B, she has back pain and a bloody discharge. Option C, she experiences abdominal pain and frequent urination. Option D, her contractions are 5 minutes apart. The correct answer is option D, her contractions are 5 minutes apart. Regular contractions that occur at consistent intervals, example, every 5 minutes, an increase in intensity, are a sign of true labor. Question 7. Which characteristic is associated with babies born to mothers who smoke during pregnancy? Option A, low birth weight. Option B, large for gestational age. Option C, preterm birth, but appropriate size. Option D, a growth retardation in weight and length. The correct answer is option A, low birth weight. Nicotine causes vasoconstriction of the placental vessels, which reduces the supply of oxygen and nutrients, leading to low birth weight. Question 8. The physician has ordered RhoGAM for an A-negative mother with an O-positive baby. RhoGAM should be administered: Option A, within 72 hours of delivery. Option B, within 1 week of delivery. Option C, within 2 weeks of delivery. Option D, within 1 month of delivery. The correct answer is option A, within 72 hours of delivery. To prevent Rh isoimmunization, RhoGAM must be administered within 72 hours of delivery or any potential exposure to Rh positive blood.